Hello and welcome. I'm Dr. George Lundberg, editor-in-chief of the Medscape Journal of Medicine. Dr. Larry Grouse of the state of Washington has had a career that spans more than 25 years, communicating health information to health professionals and to the public. He's used media such as the Journal of the American Medical Association, television, and other approaches. Dr. Grouse is here today to tell us that he thinks there's a need for a new U.S. health television network. Dr. Grouse.
Some of you remember back in the 1980s and 90s when there were national television networks for physicians and for patients. The Cable Health Consumer Network failed because advertising support was insufficient. But physician programming, which was supported by pharma, continued for more than 10 years. During their heyday, a third of all U.S. physicians tuned in at least once a month to watch the programs. Eventually, the pharmaceutical support was shifted to direct-to-consumer advertising, and the funding for physician programming on television disappeared. I think it would be a shame if television health education were lost for good, and I believe that a national health television network for both the public and healthcare professionals would improve U.S. public health. The venue for this medical television network could be cable television, or it could be delivered on the internet, or both. For consumers, there would be programs on preventing disease, as well as coverage of how to live and manage the diseases that they have. For physicians, there would be programming on the latest guidelines for diagnosis and management of disease. Modern technology in the form of a personalized health alerting and messaging service would be an effective adjunct to these programs and could be implemented through email or through cell phone communications. Government public health organizations such as CDC, NIH, or the Institute of Medicine could provide their scientific and educational resources and an administrative home for a U.S. health television network. Increasingly, there is a new consensus in U.S. politics that a comprehensive approach to healthcare is needed. A health television network would be a valuable asset for this new approach. That's my opinion. I'm Dr. Larry Grouse, the Executive Director of the AREA Initiative of the World Health Organization.